We're now going to discuss some renal issues. We'll start off with urinary tract infections. First thing to remember is under 2 years of age, urinary tract infections are more common in boys rather than girls. After that, it's going to be more common in girls. The most common cause, as far as bacteria are concerned, for urinary tract infection is E. coli. There are certain risk factors there. Obviously, after 2 years of age, think of girls, more common, simply because of their anatomy. Here is one case where not being circumcised can increase your risk for urinary tract infections. It's a tenfold risk, although the overall risk or the overall number of males who are uncircumcised who have urinary tract infections is about 1% versus 0.1% in circumcised males. Hygiene is very important, particularly in females, and that's why we start thinking about that after 5 years of age. That's when they're more in charge of their own hygiene, and they definitely become a higher risk group. If you have any abnormalities for vesicoureteral reflux, that can also lead to urinary tract infections. Anything that causes urine to be somewhat stagnant in the bladder or anywhere else in your body, as far as the GU tract, increases the risk of urinary tract infections. And obviously, older ages, sexual activity is certainly correlated with urinary tract infections. Another important thing to remember is the only way that you're going to diagnose a urinary tract infection is with a positive urine culture. That is the gold standard. That could be a test question. And certainly, since we're talking about bacterial causes, they need to be treated with appropriate antibiotics. Follow-up for urinary tract infections includes an ultrasound. Any patient that has a urinary tract infection should have an ultrasound to look for any abnormalities of the bladder or of the kidneys. Avoiding cystourethrogram is recommended in all males and in any girls under 5 years of age because there's a higher risk of anatomic abnormalities leading to the UTIs. And so we want to look for anatomic abnormalities and for reflux, and avoiding cystourethrogram is very good for detecting reflux. So any girl under 5 years of age, any male at any age should have a VCUG. Over 5 years of age in girls, we always wait for them to have a second documented infection simply because we know about they're in charge of their own hygiene and such things, and so we let them have a second one before we do such a test as a VCUG. If it's a febrile UTI, though, they also get a VCUG regardless of the age, and again, any male will do that. Another test that's used is the DMSA scan, but the first test would be, before that you would do the VCUG.